individual, this patient who is being evaluated right now, did exactly as they should have, followed the guidelines that the City of New York put out, and they met these specific criteria. They had traveled to China. They did have the specific symptoms associated with coronavirus, and they did come to get medical care here at the hospital. Exactly what we want anyone in a similar situation to do. We will, in the next 48 hours, hopefully sooner, get results back from the testing of this individual. If this is a positive case, we'll confirm that publicly right away, and the individual, of course, will be treated until they are at a point where they are no longer symptomatic and contagious. Also, if it turns out to be a positive case, the Department of Health will do the work that it is well known for in tracing back all substantial contacts the individuals had to ensure that anyone else who may have been affected gets the potential medical treatment they need. That work would start immediately in the instance of a positive measure. What I would say as a non-doctor, and then you'll hear from our Commissioner of Health, is there is still a lot we do not know about the coronavirus, a lot the global medical community does not know. What we do know causes us a tremendous amount of concern and causes the City of New York to be in a high state of readiness. This is a disease now with over 12,000 cases worldwide, 8 of them here in the United States, and 259 individuals have died so far globally. We take it very, very seriously, and we will use all measures at our disposal to protect New Yorkers. And obviously, we are working now with the guidance provided by the federal government. We're going to work immediately to implement that guidance. There's a lot we still need to get clarity on regarding it, the orders that were issued. There's a lot we have to work through with the Centers for Disease Control. There are many outstanding issues. But what's clear is we're going to work immediately to keep all New Yorkers safe. My message to New Yorkers, first of all, for the vast majority of New Yorkers, the most important thing to recognize is this issue is being addressed. It's being addressed by the federal government. It's being addressed by the city government, which has the strongest public health apparatus in the nation. People should be very clear about what this disease is and what it isn't. And New Yorkers, I always say, are not intimidated easily. New Yorkers should go about our lives, continue doing what we do normally. You can rest assured there will be constant updates on the situation. We understand some things about this disease. As I said, others are still unclear. But what is clear is the only way you get it is with substantial contact with someone who already has it. You don't get it from a surface. You don't get it from glancing or very temporary contact based on what we know now. So the bottom line, traditional rules of public health apply here. Just be smart. If you're in the presence of someone with symptoms, make sure that if that person needs medical care, they're getting it. Do the basics like wash your hands and all the things you would normally do during flu season. And if you know someone, this is the crucial point, if you yourself or anyone you know matches the criteria here, they have the symptoms and they have a connection to travel to the affected areas of China, see a medical professional immediately. That is the most important thing. For the vast majority of New Yorkers, they will never have a reason to have to follow that guidance. But for anyone who has been to the affected areas of China or been closely connected to a family member or others who have the symptoms, and then if they have those symptoms themselves, that's the kind of person who needs to get to a doctor immediately. And I have to emphasize immediately. That's how we ensure that each individual gets the help they need and that this problem does not spread. We are going to be working together again, federal government, state government, city government, all together. And I ask every New Yorker to help spread this information. And if you yourself need care or you know anyone who does, do not hesitate. Get that care right away. Just very quickly in Spanish before turning to our health commissioner. Es posible que hay un caso de coronavirus en la ciudad de Nueva York. El riesgo sigue bajo, pero todos deben seguir medidas de seguridad. Si usted estuvo en el área afectada o si tiene algún síntoma, vaya a un doctor de una vez. With that, I'll turn to our health commissioner, Dr. Oxiris Barbot. Give you a little extra height there.
Yes,
there you go.
I'm gonna try.
You can do it.
Thank you. Good evening. So as the mayor says, we are confirming our first individual who has been designated as a patient under investigation. This individual did what we have been asking New Yorkers to do, which is if you have traveled to affected areas in China within the last 14 days and you have symptoms, fever, cough, shortness of breath, or you're feeling unwell, to contact your doctor or to seek care in an emergency department. Additionally, this particular situation really highlights the fact that all of the measures that we have put in place with our partners are working the way that they should be working, so that when the patient presented here to Bellevue, they were appropriately evaluated, the appropriate first-line tests were done to rule out a potentially common virus that could have been accounting for those symptoms, and they immediately called us when they had the information that indeed there was positive travel and a negative biofire. Because of patient confidentiality, we're not going to share any detailed information, and the only thing I will say is that the patient is stable and doing well. It's a reminder, however, that there are many New Yorkers across the city that are understandably anxious about what they may be seeing in the news, and that sometimes there are folks who prematurely think that they have a person who has coronavirus, but I want to assure you that we have strong systems in place to ensure that as soon as someone presents at one of our emergency departments or sees one of our physicians in the city, that we've got measures in place, and we will promptly bring that attention to New Yorkers. It's also an opportunity for me to remind New Yorkers that the symptoms that can be consistent with the coronavirus are also the ones that are consistent with influenza. And so this flu season is a very strong and heavy flu season, and it's not too late to get your flu shot because it's very easy to confuse the two. The last thing I will say is that this is a time for New Yorkers to continue their vigilance and to continue the advice the mayor gave, which is if you've traveled to the affected area in the last 14 days or have come in contact with someone who has traveled and are feeling unwell, call your doctor or come into one of our emergency departments and we will take care of you. This is not a time to fall prey to false information that you may be seeing on the internet, to fall prey to the stigma that is trying to be propagated. This is a time for New Yorkers to know the facts, to help spread the facts, and to seek care early. Thank you.
Thank you, Doctor. And 2 points. One, anyone who needs care, anyone who believes they have the symptoms and needs medical attention should not worry about the cost of it. You can come to one of our public health facilities, one of our hospitals or clinics. Obviously, that care will be provided immediately. No one should hesitate. Second, I want to thank everyone at Bellevue. This is a place that has dealt with some of the greatest health challenges over the last decades, including some of the most frightening international phenomenon that visited us here in New York City. And this is, I think, a place unparalleled on the earth in terms of having the ability to deal with something like this effectively. So once again, the whole team at Bellevue, everyone who works here, the doctors, nurses, everyone, finds themselves in the forefront of a nationally important situation, and they are more than up to the task, and I want to help I want to thank every one of them for all they're doing to help all of us. With that, want to take any questions? Yes.
I actually have a question for the commissioner and a question for you, if you don't mind.
Please.
Commissioner, I know obviously the patient is entitled to confidentiality. Could you say anything about how this person came into the country? You said, did the person present themselves here at Bellevue on their own, or were they brought here? Could you just talk a little bit about the timeline as best you can?
So the patient felt unwell and presented themselves to Bellevue Hospital.
And in terms of the flight, did they fly to JFK, or were they flying to somewhere else?
So I don't have the details whether they came. Whether they came in on a direct flight or an indirect flight. But the point is that they followed our instructions, were unwell, and sought the care that they needed quickly.
And Mr. Mayor,
Yeah.
I'm struck by the sense of pain that we were a couple of years ago, you and the governor right here,
Yep.
on Saturday night doing this.
Yep. This is much different.
How do you contextualize this?
Look, I think we should remember, and I remember those days very vividly during the Ebola crisis. We were dealing with the great unknown, and we were dealing with a disease where there were a lot more answers, and they were really bad answers. We know the spectrum in which this disease exists, and it is very frightening, but it is not Ebola. Ebola was a devastating disease. And yet the professionals here at Bellevue handled it head on, and New Yorkers, and I was really proud of New Yorkers then, they didn't panic, they went on about their lives, they listened to the guidance, they acted on the guidance. So I feel if we could get through that, I have no doubt we can get through this. But it is bringing back those memories for sure. Yes?